Use another metaphor to reinforce it. It's a little bit like having a bucket.
And get a bigger bucket. 네, 구독자 여러분 안녕하십니까? TV 리포터 최현재입니다. 현재 대한민국에서는 정부와 의사들의 의견이 어긋나면서 의료 대란이 벌어지고 있습니다. 의료 선진국으로 손꼽히는 영국에서도 의사들이 파업을 시작했는데요. 그 배경은 무엇이고 영국 의사들이 생각하는 우리나라 의료 대란은 어떠한지 파업에 들어간 영국 가정의학과 총연수생 대표와 현재 활동하고 있는 영국 의사들을 만나 의견 물어보았습니다. So let's begin. Can you please briefly introduce yourself?
Hello, my name is Che-Ho Huang. I'm a GP, a general practitioner in East London, working there for the past few years now.
Hi, my name is Dr. Malingaratwatta. I'm a GP resident doctor in North London, and I am chair of the British Medical Association's GP Registrars Committee. Thanks for having me on.
And hi, I'm Dr. Raphael Rifkinzewitz, 3 years into my psychiatry residency, also working and living in South London. Thanks for having me on. Yeah,
so doctors in the UK have been in dispute with the government now for about a year and a half, really, mainly over pay, postgraduate training to specialise. And over the last 15 years, these doctors have experienced pay erosion in real terms of 26%. And that's had a significant impact on their ability to pay their bills in the context of a cost of living crisis, and it's having a significant impact on morale. So really the ask from doctors who are on strike at the moment in the UK is about reversing that pay erosion that has taken place, and to engage in dialogue with the government to look at how we can get pay in real terms back on track compared to where it used to be.
I think I would add that, much like in Korea, where it sounds like there's a central dispute, there's also lots of other things that doctors in the UK are unhappy about. To name a few, the rise of, I think, physicians' associates has been hitting the news a lot, and that's something the BMA has been pushing on, around trying to essentially replace doctors with less trained equivalents, put them on equivalent doctor rotas and push out doctors from training opportunities, which I think is something that a lot of my colleagues feel quite strongly about. And
so I think the Korean government saying that we need more doctors is nothing controversial, really. How you bring about that change is actually really important, and I think that's part of the reason why the Korean doctors are having a dispute with the Korean government right now.
What you could end up having is a situation where even if you have more doctors who are trained, if retention and your remuneration of those doctors isn't sufficient, those doctors will potentially leave the profession or leave the country. And so you don't actually achieve that goal of having doctors who are willing to work within the system to provide care to patients. So, for example, in the UK, I represent GP registrars. We've had an increase in the number of GP registrars who are being trained from about 4,000 per year up to 6,000. But we're actually not seeing a commensurate increase in the number of fully qualified GPs. And we believe that part of the reason for that is because when we don't consider working conditions and remuneration, a number of these GP registrars who finish their training actually leave the UK. They go to countries where they feel more valued, like Australia or Canada, for example. Use another metaphor to reinforce it. It's a little bit like having a bucket. So you can increase the amount of water that you're pouring into the bucket, but if the bucket has holes in it, the water will still leak out. And so if you want more water to stay in the bucket, you've got to increase the amount of water going in, but you've also got to fix those holes.
And get a bigger bucket.
I think part of it stems down to a lack of communication, so that we're both coming to the table to find solutions together that work for everybody, government, doctors and patients.
What currently the striking and this communication process is about is trying to ensure we have a better way of working. We want to heal this and move forward, and I think that's what the Korean doctors might be trying to do here.
And similarly in the UK, there's an analogy to that. I think junior doctors often felt that the council that regulates us, the GMC, doesn't carry out its investigations to doctors in a good way, doesn't think about doctor well-being. And we've also had our gripes with how we're trained and access to good quality training. And so although it is about pay here and it is about numbers of doctors recruited there, it's also about other things and trying to foster a broader culture of discussion and thoughtfulness, and I think, in how we treat our doctors.
I think it comes down to understanding of what the issue is. So I think it's easy to come out to the public and say, we're going to make more doctors. But referring back to what I mentioned earlier, I'm not sure that that's actually necessarily going to solve the problem that the public actually care about. So the public want to be able to access a doctor and see a doctor when they want. But the creation of more doctors might have inadvertent consequences that the public don't necessarily fully understand because it hasn't been explained to them in an open way.
One of the problems with just increasing a very visible part of the medical system, you need, like Malinga was saying, the systems in place to also be able to adapt to that, whether that's the education of doctors or let's say they've graduated, then where in the system can they be put into to also be effective for society and to be able to serve the society? The whole system probably needs not just more doctors, but everybody to work together, and that will often mean more nurses, more everybody else, in order to ensure that the 2,000 extra doctors, or however many doctors that the Korean government is trying to increase by, is also being supported to work effectively as well.
Like I alluded to earlier, increasing the number of doctors alone might not actually make the experience better for patients. And I think that's truly what the public care about, is actually, can I see a doctor? How do I see them? Is that going to work for me? Can I receive the healthcare that I need? But I think what would help is actually having broader discussions, even with the doctors and the politicians, to really understand the complexities of the issue and to see, is there a better way that taxpayer money can be spent in order to achieve the same goal?
I think luckily in the UK we have the support of the majority of the public for our strike, and there's a recognition that the environment in the UK, patients are being harmed every day by the fact that there's 80 million people on our waiting lists, by the fact there's been underfunding for 15 years by the government. But from my understanding of what's happening in Korea, there's similar concerns about unrecognised problems in the health service when it comes to under-rumination of, for example, emergency procedures compared to, let's say, plastic surgery, which is driving doctors into specialising away from the specialties that are needed. There's more draw areas to cities, people want to live in them. Often the rural hospitals have bad infrastructure, bad training. They're not as well supported. So there's all of these factors that mean that people want to end up working and living in cities. As Ming was saying, there are methods that the government's exploring to try and counter that. So one is pay attraction to rural underserved areas to try and pull people towards them. Another is a bit of a redistribution of training places. So as we've said, the government controls where places are offered, and they're currently in the midst of a redistribution scheme where they offer less places in London and more places rurally. It does again come in the context of reducing training numbers and reducing ST places, which is the second level of doctor training in the UK.
But I think there are again policies that can be implemented to address that and to mitigate for that. And I think working with doctors and talking to doctors is the best way to identify them. It's certainly, I suspect, a problem across many countries. But finding ways to attract doctors into rural areas, like, for example, interesting training opportunities and other benefits outside of financial benefits, for example, might be a way to address that.
So I think doctors, just like anybody else, are dominated by their own personal desires as well, and that can be the safety of their family. One thing that you could say is, if you go to a rural area, perhaps then to help with relocation and to help with supporting family structures, including that of funding for nursery, schooling, and improving those things in the community would be really helpful. Then I think perhaps looking outside of just directing things at doctors and directing things more at the communities and funding those communities to become more attractive places for doctors to go to might be a better option, which is better doctors in the places that we need them to go.
I suspect no Korean doctor wants to be out on strike, and I think they would want to understand the government's concerns, and hopefully I suspect they have ideas about what could be a way out of this crisis, and I think trying to understand that is potentially the next step, really. But I do stand by the idea that actually dialogue's important, and we need to get to a position where everybody is willing to talk.
I guess what I'd add to that is it needs to be clear to all parties that dialogue is what people want. So I think one of the concerns with our government was that they said they wanted dialogue, but they weren't introducing any of the changes. And part of that can just be to run down the clock, run down times. There needs to be genuine moves from the government to show they are open to change. And from my understanding with the Korean strikes, they implemented this change, and the doctors want them to unimplement it and then come talk to them.
Being ethnically Korean myself, our people have gone through multiple hardships in the past few generations, and we're still in the midst of a country that is divided. Let's try not to divide society even further and just ensure that we're on the same side. We're all here to serve one people. And from the UK doctor side and the UK government side, that is the UK. And from the Korean doctors and the Korean government side, that is Korea. And I think with that in mind, given that you're both trying to aim for the same thing, let that be the starting point for essentially peace talks, and to move on from the fact that we are continually hurting each other by not having dialogue and communication and trying to understand each other.